My scoliosis that I was born with has increased over 20% in a year.
More and more patients are presenting to us with significant deformity.
For those of us who take care of patients with complex spinal conditions, what we see is the significant impact on quality of life.
When you think about treating very complex spinal disorders, one of the biggest problems with those cases is that they're often fraught with excessive amounts of blood loss.
15, 16-inch incision.
And going in and putting rods and screws the entire length of their back.
Stripping down of the muscles, devascularization, denervation.
Prolonged operative times and the concomitant risks associated with that.
The XLIF procedure, you can maximize what you do for the patient through the least invasive portal possible.
Hopefully I'm going to regain some of my mobility, be able to do some of the things that I can no longer do.
With minimally invasive techniques, you're relying a lot on the imaging, on the monitoring, on all of these advanced technologies.
With the XLIF, you go in through the lateral aspect of the body and just dilate a muscle, so it's not actually dissecting it, and then you're able to do the graft, and the time, comparatively, traditional one-level fusion could be a multiple-hour procedure. Typically, with his lateral procedure, it's about an hour.
One of the critical aspects of the evolution of minimally invasive surgery has been the confirmation that the techniques are as effective as the traditional open techniques. What we create is a situation of increased value for the patient, for the hospital, and even for the surgeon.
Performing these lateral access procedures has enabled us to provide a unique procedure that has minimized the amount of pain that the patients go through, almost eliminated infections altogether, dramatically decreases the amount of pain medications that they're going to require after surgery, and allowed us to get people back to work and feeling like contributing members of society again.
The hospitals spend less money on a patient that undergoes a minimally invasive procedure. We're not taking care of them for several days after surgery.
We've seen the evolution of minimally invasive techniques for spinal surgery, and it's been the introduction and maturation of these minimally invasive techniques that have empowered our capacity to deliver more effective care at a smaller risk for our adult deformity patients.
The XLIF procedure has become an important workhorse in my practice. For the most part, if I have a patient and it turns out that I can do a lateral access procedure or a posterior procedure or even an anterior procedure, I'm going to choose lateral. It's really enabling us to be able to take care of these patients in a much more contemporary fashion.
Everyone wins. The patient wins, the surgeon wins, the institution wins.